أشكرك. Assalamu alaikum. Our lecture today talking about the spleen, cross anatomy and imaging investigations. We started with small introductions about the spleen is an organ of the hematological system and has a role in immune storage, response, RBC, and hematopoiesis. Cross anatomy of the spleen is a wedge-shaped organ lying mainly in the left upper quadrant and is protected by the left 9 to 11 ribs. The spleen is completely covered by peritoneum except at hilum. The functions of the spleens forms part of the reticuloendothelial system. So main functions is hematopoiesis in the fetal life, and in adult with utilizations of the iron from hemoglobin of destroyed red blood cell. Red and white bulb, which are has separated by marginal sinuses. The red bulb composed of sinuses, splenic cord, and marginal zone, and main functions is to filter red blood cell and receive monocytes. While the white bulb is composed of the Malpighian corpuscles and help in active immune response. The development of the spleens is develops from the mesenchymal cell type 1 in the dorsal mesogastrum of the 5th week of gestation, sometimes say 4th week of gestation. Number of nodules develop, which soon fuse to form lobulated spleen. Notching of superior border of adult spleens is evidence of its multiple origin. These nodules, if fail to fuse, form the accessory spleen that may be found in derivatives of dorsal mesogastrum, in the broad ligaments of the uterus, and in the spermatic cord. The position of spleens in details lies between the fundus of the stomach and diaphragm, lies in the hypochondrium and epigastrum, and extend in between the 9th to 11th ribs. Let me see here. Axis of spleens is directed downward, forward, and laterally. Axis lies along the 10th ribs. Measurement of spleen. The length about 12 centimeters, breadth or width 7 centimeters, thickness 3 centimeters, and the weight 150 grams. This is the measurement of the spleen. Length 12 with 7, and this is the thickness 3 to 4 centimeters, and the weight is between 80 to 300 grams, as average 150 grams. The external features of the spleens, we have 2 ends, 2 borders, 2 surfaces, 2 angles, and the hilum. 2 ends, the anterior, or called the lateral end, it's expanded like border, it is directed downward, forward, and reach mid-axillary line. While the posterior or medial end is rounded and directed upward, backwards, medially, and rest on upper pole of left kidney. 2 borders, superior and inferior borders. The superior borders present 1 or 2 notches near anterior end. Notch indicates spleen is lobulated in development, while the inferior border is rounded. 2 surfaces of the spleens. We have the visceral and diaphragmatic surface. This is the diaphragmatic surface, and this is the visceral surface. The diaphragmatic surface is convex and smooth. It is related to diaphragm, left lungs and its pleura, costo, diaphragmatic recess, and 9th, 10th, and 11th ribs of left side. While the visceral surface is concave and irregular, it is related to the fundus of the stomach, anterior surfaces of the left kidney, the splenic flexure of the colon, and tail of the pancreas. So this part, the visceral surface, have impressions on its margins, the gastric impression, renal impression, colic impressions, and pancreatic tail impression. This picture is clear the impressions, colic and pancreatic, and the renal impressions and gastric impression. We have 2 angles, anterior basal and posterior basal angle. Now the ligaments of the spleen. We have the gastrosplenic, linorenal, linophrenic, or phrenico-colic ligaments. The gastrosplenic connect the fundus of the stomach to anterior lip of hilum of spleen, contain the short gastric and its gastroepiploid vessels. Linorenal connect anterior surface of the left kidney with posterior lip of hilum of spleen and contain the tail of pancreas, splenic vessels, and nerves. Venophrenic suspensory ligament of the spleen and phrenicocholic support the spleen from below peritoneal fold extending from its colic flexure to diaphragm. هنا عندنا واضح الجاستروسبلينيك ligament and splenorenal ligaments. The blood supply of the spleen, the short course of splenic artery arises from the celiac trunk and runs along the upper border of the body and tail of the pancreas, which gives small branches. The short gastric and left gastrooblique branches passes between the layers of the gastrosplenic ligament. The main splenic artery generally divided into superior and inferior branches, which in turn subdivide into several segmental branches. We have here the aorta branch of the cecal trunk that gives splenic artery and hepatic artery to form the cegal sign of the celiac trunk. Venous drainage. The splenic vein drains into the portal vein. So the blood supply, the arterial from the splenic artery and the venous drainage from the splenic vein. Nerve supply is predominantly supplied by the sympathetic from celiac plexus. The fiber supply the blood vessels and the smooth muscles of the trabeculae. And now with imaging investigations of spleen. We have the plain radiograph of abdominal AB view and ultrasound transabdominal as first line investigations, and then multi-slide CT and MRI. Started with plain radiograph is limited rule, detected overriding colon in autosplenectomy and splenic calcification due to TB, cyst, and splenic infarction, like we see in these pictures, is overriding of the colon because autosplenectomy. Here we have the splenic calcifications. Ultrasonography, ultrasound, the spleen is homogeneous, slightly hyperechoic than normal renal cortex and isotope slightly hyperechoic than liver parenchyma. Its detected splenic length is up to 13 centimeters. Splenic vein diameter less than or equal to 9 millimeters. Splenic artery about 6 millimeters. Detect uncharacteristic splenic focal lesions whether cystic or solid. طبعا هاي general rule الالتراساوند تشوف انها cystic lesion or solid lesion. Multi-slide CT abdomen. On enhanced CT, the spleen is homogeneous with attenuation value ranging between 40 to 60 household unit. That is 5 to 10 less than the liver. The normal spleen enhancement is mottled appearance or pattern due to arterial and early portal venous phase due to variable blood flow. هذا mottled appearance بالearly enhancement portal venous phases أو بالarterial. Delay phase is scan 3 minutes after contrast injections. It's helpful to exclude splenic laceration in post-traumatic patient. MRI on T1, the normal spleen has homogeneous low signal intensity that is slightly less than that of liver and muscle, and on while on T2 weighted image signal intensity is higher than the liver parenchyma. وأيضا يطلع لنا بالenhancement اللي هو mottled appearance أو يسموها بالزبرة باتان. And now with imaging pathologies. Imaging pathologies of the spleens is may be congenital, تكون accessory spleen مثلا Windring spleen, aspleenia, Angoli spleenia, and else. الماسز ممكن تكون benign أو indeterminate أو malignant. الbenign tumulus مثل splenic cyst and hemangioma أو lymphangioma abscess. المalignant ممكن تكون metastasis, lymphoma وإلى آخره. ممكن تكون أيضا infiltrative disease مثل TB, siderosis أو others ممكن تكون تروما أو infarctions. مثل ما قلنا قبل شوية إنه الامبريولوجيكال ديفلوبمنت أوف ذا سبلين يبدينا بالفورث ويك condensations to fuse together. A failure of this fusion حيكون لنا عدة congenital anomalies. بدنا نشوف هنا هاي السبلين والنيوكلياي في هاي الصورة. ممكن يكون اسبلينيا، ممكن يكون بوليسبلينيا، ممكن يكون wandering للسبلينز نتيجة laxity للسسبنتري ligament أو long ligament عندي يخليه يتحرك ب other positions غير مكانه. ممكن يكون عندي سبلينو جونادال فيوجن مثل ما نشوف هنا، عندنا راح يصير الفيوجنز ويا الجونادز. اللي هي التيستس. السبلينوسيس طبعا طرقت لنا انه على مود نفرقه ويا الكونجينيتال بارت من هذا الاكسسوري سبلين هو كونجينيتال يعني هو نفس السبلينيك تيشو unlike اكسسوري سبلين لكن هاي الحاله تكون acquired condition resulting from seeding or implantations of the implantation of splenic cell after splenic trauma or splenectomy. Occasionally, this splenosis occur in extraperitoneal locations such as the chest area وبما انه صار ectopic position فالسيتوغرافي والتكنيشن 99 سيلفر كولويد يفيدنا يعني to the accessory or ectopic implantation. The simple splenic cyst, most common benign focal splenic masses. We have two types, true cyst about 20%. It has epithelial lining and could be congenital or hybrid cyst, while the pseudocyst 80% no epithelial lining with neural calcification and could be sequel of a trauma, infection or infarction. نضيف هنا السبلينيك سيست السمبل بالالتراساوند وبالسي تي وبالام ار. Simple splenic cyst differentiation ما بين الترو والسيدو cyst impossible in most cases and has no clinical impact on treatment or follow-up and determined it. So the CT and MRI no need for further evaluations because it's simple cyst. While the complex cyst means that the cyst has one or both of the internal soft tissue component and thick internal septations, while complicated cyst mean that has thick wall, thin internal septations, calcifications, maybe mural or internal, and turbid fluid contents. Complicated cyst is benign features, while complex is suspicious and need further evaluation. In complex cystic lesions, contrast enhanced MRI is needed for further evaluations. If the lesion has signal and enhancement characteristic of hemangioma or hemorrhagic cyst, no follow-up imaging is necessary. If indeterminate on MRI, follow-up imaging in half to 1 year is recommended to monitor stability. The differential diagnosis of indeterminate solid masses include hematoma, lymphangioma, littoral cell, angioma, and angiosarcoma. أي واحدة من دول إذا لقيناها نعطي 6 إلى 12 months follow-up. Splenic lymphoma, both Hodgkin and non-Hodgkin lymphoma represent the most common malignant neoplasm of the spleen. A primary involvement is 1%, while the secondary involvement is 99%. The imaging evidence of lymphoma, homogeneous or heterogeneous splenomegaly, miliary non-enhancing hypo T1 intense dense echogenic nodules and hyper on T2, solitary mass, multiple large masses, changing to iso hyper dense echoic denota regression due to fibrosis, and any variation in the size of this lesion is more indicated is lymphoma than the abscess or infarction. Like we see here, multiple form lymphoma تجي ممكن تكون شكل single masses ممكن تكون multiple masses ممكن بعض الأحيان تكون فقط سبلينوميجالي. Splenic infarction, another common pathology or disease, either arterial or venous origin. Chronic infarctions decrease in size, resulting in fibrotic retraction of the splenic capsule. Complications of the infarction, splenic rupture, splenic pseudocyst formation, hemorrhage, and abscess formation or infection. Imaging features يكون with shape area with its apex pointed toward the splenic hilum يكون hypodense ممكن echo كان ايزو هو يكون او hypo. Differential diagnosis of the solitary splenic masses ممكن تكون hemangioma, hamartoma, lymphangioma, and littoral cell tumor and angiosarcoma. طبعا ممكن يعني غطينا اكثر الباثولوجيز اللي موجوده بالايميجينج اللي نشوفها والكومن يعني ذكرناها. And now with the quiz time.
عاشتي الدكتورة هدي الكريم، بس انت يعني غطيتي الباثولوجي تغطية كاملة بالنسبة للطلاب، يعني انتم هذا الباثولوجي شو اسمه يعني ما مطالبين به، خلوا ببالكم بس مطالبين بالسايز الهوموجينيتي مالته بالسي تي الانهانسمنت. اكو هاي الزبرة طلعيها، هاي مهمة تركزين عليها. هذه الاشياء الباترن اوف انهانسمنت، النورمال فاريشنز، الاسبلينيال، البوليسبلين، بس انتو هاي ترى ما مطالبين بها. الاسكيميا والسمبل والسودوسيست والهوجكن والنون هوجكن هاي كلها ما مطالبين بها، بس انتو تقدرون هم تحتفظون بيها، هي تعبانه عليها شو اسمه
هذا الموتال ابرنس او يسموه الزبرابات، يعني طبعا هذا نشوفه بالسي تي او ام ار اي ايضا بنشوفه.
اي موتلينج هذا ديفرنشال باترن اوف انهانسمنت، هذا عاده شو وين نشوفه بالايرلي ارتيريال فيز يعني.
نعم.
على كل هاي الاشياء اللي المهمه انتم تعرفوها، بس الاشياء الباثولوجيكال اللي هي تطرقت لها ترى ما مطالبين بها، بس مجرد تمرون عليها مره الكرام يعني اللي عنده شو اسمه الوردنرينج سبلين، هذا من ضمن الانوماليز اللي مهمه همينه، فتخلوها ببالكم. نروح على الكويز. كم صوره عندك؟
2 عمو. اول وحده هي بس مجرد يعني one questions يعني mention the contents of this.
استاذ محمد انت يعني اخذ الكويز، انا اخذت هاي. يلا استاذ محمد تفضل.
ياسمين.
نعم أستاذ. Splenic artery and vein with tail of the pancreas.
The contents of the splenorenal ligaments هي splenic vessels, artery and vein and tail of the pancreas.
جيد.
Name the structure label.
حرف أي. هدى رعد.
نعم أستاذ. tail of pancreas.
tail of the pancreas.
نعم.
بي مصطفى خضير.
نعم أستاذ. This is accessory spleen, spleniole.
accessory spleen أو splenic صح. محمد خضير. سي.
نعم أستاذ. inferior vena cava.
سي inferior vena cava. فرقان. دي.
splenic vein.
splenic vein. وآخر شيء علاء نايف.
left adrenal gland.
left adrenal gland. هاي خلص. لو عندك بعد شيء.
نعم هاي.